class today, 3 people. Holy. My name's Chloe, and I'm going to be teaching the class Kinematics of Injuries. Woo! Thanks. Okay. So first we're going to go over trauma care. Does anyone know what trauma care is?
No.
Cool.
No.
There are 3 phases of trauma care. The pre-incident, incident, and the post-incident. What's the pre-incident?
What happens after the incident?
No. Okay. Is it? No, it's not. Pre-incident prevention phase. I need to look at my own notes here. Look at me. Look at me go. I'm a bad teacher.
How long have you been teaching?
I just started. I did.
Oh,
5 minutes in.
I guess that explains it.
Yep. So pre-incident is the prevention phase. The incident is the actual traumatic incident itself. Post-incident is the care on scene and en route. Okay? The trauma deaths are categorized as 3 periods. What are they?
Dead, and other.
Cool. Immediate, early, and late. Immediate being right away, early 2 to 3 hours post-trauma, and late days or weeks after. Why? Days or weeks after, why?
They're dead.
Sepsis. Infection. Death. Okay? We have now kinematics. It's the process of predicting injury patterns.
Do you want a ruler to write this straight line?
That's important. That is the most important thing. Okay. Consideration when evaluating trauma patient: age, protective factors, mechanism of injury, force applied, anatomy, and energy. What is the most important thing of kinematics?
Was I supposed to be taking notes?
The process of predicting injury patterns. Okay? Now we're going to go on to energy, because you guys are falling asleep here. Snip, snap. Okay? Trauma injuries are transfer energy from external source to human body. A set of injuries determined by type of energy applied, how quickly it is applied, and to what part of the body is applied. Wake up! Okay. Physics laws. Has anyone taken physics class in your life? Probably not. You're all slackers. Okay? So now we got Newton's first law. Does anyone know what that is?
Newton's first law, the first law you made.
It's the one with
Yes, that's correct. You're getting there. I'm getting some type of feedback. It is an object, whether at rest or in motion, remains in the same state until acted upon on an outside force. Okay? Newton's second law of motion.
It's the second law you made.
Okay. Force equals mass times acceleration or distance. Okay? What does that say? Force equals mass times acceleration.
Deceleration. Over deceleration.
No, that's just or. That's an or. Yeah, it could be an or. Okay? It's an or factor. Okay, now, flip to my other thing here. Conservation of energy law. Energy cannot be created or destroyed. It can only be changed forms. Okay? Energy forms, what can they come in?
I don't know.
You don't know?
Gas, liquid, solid.
No. If you're, yeah, but no.
Kapoof?
No. Mechanical, thermal, electrical, chemical, nuclear. Kinetic energy. Does anyone know the formula for kinetic energy?
Something with a K and an E.
Yes. K and E. I'm going to give you that. 1 over 2 times velocity squared. That's what it is. And this is kinematics of injuries. What is the most important law? What is kinematics of energy? Yeah. What is it? It's on the board.
Process of predicting injury pattern.
Yay! Thank you, class. You all are falling asleep. Let's go. So
Blunt trauma. Like that. Injury produced by forces of compression and a change of speed. This may cause tissue disruption. Direct compression or pressure on a structure, most common force applied. Amount of injury depends on the length of time of compression, the force of compression, and the area compressed.
Compression injuries. Compression injuries occur when the head strikes a stationary object and the cranium comes to an abrupt stop. This may result in fractures associated with contusions and lacerations of the brain.
Oh no, I've been in a head-on collision. Ow. My femurs hurt because they went down and under and hit the dashboard. I'm so glad that they let me back on the road. Oh no! I went up and over the steering wheel. Ow! My ribs and internal organs.
So, as the body is pushed forward, it causes damage to the thoracic region and the abdominal region.
Lateral impact collisions. The main thing that we're looking for in a lateral impact collision is whether the damaged vehicle has moved from the point of contact or not.
Rear end impacts. Vehicle struck from behind rapidly accelerates. Vehicle moves forward under the occupant. And the difference between the speeds is the damaging velocity.
Rollovers. Rollover injuries occur when the vehicle rolls over. This leaves the occupants to tumble inside of the vehicles, causing injury to wherever the body strikes the car. This can include multi-system trauma and axial loading. This type of MVC can produce injury patterns associated with other types of MVCs.
Rotational impact. The off-center portion of a vehicle strikes an immovable or slow-moving object. This causes the vehicle to rotate, transferring rotational forces inside the vehicle where the occupants are.
Deceleration injuries occur when your internal organs continue to move forward after an abrupt stop or an impact. This causes risk of organs separating from their attachment. So as in an accident, we pull forward, we stop, our internal organs continue to move forward into the seatbelt, and this also causes thoracic and abdominal injuries. Now we're going to be talking about auto pedestrian collisions. We're going to be looking for 3 types of impact, which is the initial impact, which is the vehicle striking the patient. The second impact is the patient striking the hood of the vehicle. And the third impact is the patient striking the ground or another object. One thing that we need to make sure of with adult pedestrians is that when they're struck by the vehicle, they are often hit from the side or from the back. So we're looking at lateral or posterior forces. As you can see, as the vehicle strikes the patient in either direction, we're looking at a possibility of a tib-fib fracture. As the patient strikes the hood of the vehicle, we're looking at a possibility of thoracic injury. And as the patient strikes the ground or another object, we're looking at a possibility of cervical or spinal injury. Next, we're going to talk about the child patient. Children often experience frontal impact because they often face the vehicle. Their injury pattern is known as Weddell's triad. So as the vehicle strikes the child, there is the possibility of a broken femur. As the child strikes the hood of the vehicle, there is the possibility for chest injury. And as the child falls to the ground, there is the possibility for head injury. Another common thing that happens with children is the vehicle will often drive over the child, and the child will often be found behind the vehicle. Another important thing to remember about predicting injury patterns with auto pedestrian collisions is the age of the patient, whether they're a child or an adult, the height of the injury, so from where they fell, as well as the velocity of the vehicle. Vertical falls are often a result of deceleration and compression. As you can see, he falls. As the patient hits the floor, that is the deceleration because you are slowing speed down. And then the compression is the force of you hitting the ground and compressing your structures. In predicting injuries associated with falls, you want to make sure to evaluate like the distance fallen, the body positioning that our patient is in. Like this case, he's kind of sprawled all over the place, and we could possibly have an injury to the shoulder or the arm because he fell like this. The type of landing surface struck, so in this case, it was the hard floor, and the age of the patient. Well, we just have a banum. Now we're going to talk about sports-related injuries, my favorite topic. These injuries are often specialty injuries caused from sports such as football, soccer, basketball, swimming, diving, to name a few. The causes of a lot of these injuries often include forces of acceleration and deceleration. So think about football and tackling, compression, such as diving and hitting your head on the bottom of the pool, twisting,
such as an ACL tear in soccer, hyperextension, like this, of the elbow or knee, or hyperflexion, like this, of the elbow, knee, neck, etc.
Ah, that blunt trauma from earlier has caused some temporary cavitation in my shoulder as the lateral force pushed the tissue away from the injury. This can be affected by the ability of my tissue to rebound after said injury.
Go.
Oh my goodness, I have suffered a low energy penetrating stab wound. Whatever shall I do?
Well, our friend here has a stab wound. These stab wounds can be caused by knives, needles, etc. The amount of tissue damage is typically limited to the path of the projectile. It's also important to note that the underlying structures could be damaged, and there could be multiple stab wounds. Ow, I've been shot.
Hi there, this is Ryan. Ryan has been shot by a gun. Now, this could either be considered a medium or a high velocity. When assessing for gun wounds, you have to check for the entrance and exit wound. The difference between a medium and a high velocity is that both of them have an injury tract of 2 to 3 times the diameter of the projectile they've been shot with. But the difference here is, with a medium velocity, it's less than 1,500 feet per second, and with a high velocity, it's more than 1,500 feet per second.
Ah, that bullet wound from earlier has left a permanent cavitation.
Wounding forces of medium and high energy projectiles. Tissue distribution is caused by localized crush of tissue in the missile's path and the momentary stretch of surrounding tissues. Differences in wounds caused by projectiles varies with the amount and location of crushed and stretched tissue. Depends on projectile mass, deformation, fragmentation, type of tissue struck, striking velocity, and the range. Shotgun wounds, short-range, low-velocity weapons. Energy transferred to body tissue and resultant tissue damage depends on gauge of gun, size of pellets, powder charge, distance from the victim. Entrance and exit wounds. Appearance of entrance and exit wounds is affected by range, barrel length, caliber, powder, weapon. Entrance wound, usually round or oval, may be surrounded by the abrasion or collar. If firearm was discharged at an intermediate or close range, power burns such as tattooing may also be present. Exit wounds, if present, are generally larger than entrance wounds. As the bullet exits the body, the skin may explode. Ragged and torn tissue can occur. Splitting and tearing of often produce a starburst or stellate wound. These are pictures of entry wounds, the sizes, and exit wounds. Head injuries, frequently severe face and neck injuries, significant blood loss, difficulty in maintaining airway control, spinal instability. Thoracic injuries, gunshot wounds to the thorax may result in severe pulmonary and vascular system injury. Pneumothorax and tension pneumothorax should be considered. Vascular trauma may result in massive internal and external hemorrhage. Thoracic trauma may be present without visible chest wound. Abdominal injuries, gunshot wound to the abdomen usually requires surgery to determine the extent of injury, may affect multiple organ systems, damage to air-filled and solid organs, vascular injury, spinal column, and spinal cord injury. Here you see an entry and an exit site with remained bullet. Extremity injuries, gunshot wounds to the extremities, occasionally life-threatening, may result in lifelong disability. Here you can see a woman's foot had been shot straight through. She has extensive tissue damage.